Hi, doctor.
Hello.
So, in recent times, we could see that bone and joint problem are something that is only not catering to senior citizens but
Yes.
also to young adults.
Mm.
So, what is the comparison? What kind of risk factors or symptoms are there in young adults and in with senior citizens? If you can help us with that.
Let's start with the young first, young people. So one form is basically injuries which happens due to any unfortunate accidents or in sports where people land up in injuring their knees, elbows or any other joints. Or there are a lot of enthusiastic individuals who have recently joined their gym, and from the very first day itself they try to do too many things, trying lifting heavy weights without proper precautions, so they also land up in various injuries in different parts of the body. The other section is basically a sort of what we call a long-term arthritis or an autoimmune arthritis, like say rheumatoid arthritis, where the body immune cell acts against its own joints and tissues, where there's an inflammation in various joints like the knees, the wrists, the finger joints, and they end up having sore joints, which is typically worse in the morning, a lot of stiffness, pain in the joints. The other part is basically where young, particularly the young individuals, have pain in their back. The spine or the sacroiliac joint beside the spine is typically involved and inflamed. So such individuals, when they sit or stand for long time, have pain in the back. They have difficulty in bending forwards, or the pain is aggravated when they start lifting weights. This is the young. And if you come to the elderly, well, in the elderly population, with age there's a degeneration of every tissues and muscles of the joint. The bones are worn out, the cartilages, the muscles grows weak. So elderly individual most often have chronic pain in their knees, hips and various other joints of the body.
Thank you, sir. Secondly, like what are the lifestyle factors those are that are responsible for an early bone and joint problem for individuals?
Nowadays, if you see, most of us are having a sedentary lifestyle where we work for long hours, sitting in front of a laptop or office. So, and that also, there's also a change in a food habit. We are not taking the food in at proper intervals at proper times. There's a lot of stress in the work which also affects us, and the sleep pattern is also disturbed. So this altogether creates a lot of imbalance in our body, which increases our chronic pain, back pain, neck pain and joint pain.
Also, if you can see us nowadays, how we can, being an individual, how we can differentiate what is a normal, just a stiffness, or a difference between a arthritis pain or a bone and joint issues.
A normal stiffness and pain may happen after any injuries or any unaccustomed activities, but they get better with after certain point of time with a little bit of rest, ice packs. But when the pain stays for long duration, I mean it's not getting better with time, it's getting progressively worse. We are not able to do our regular activities or walking. This is a matter of concern. Or as I said earlier, the autoimmune diseases, or the arthritis, the rheumatoid or the sacroiliitis, they tend to stay for long duration. They get progressively get worse with time. So if a joint pain is not getting better, if your joints are swollen, if your joints are reddish, you are in a lot of pain, or you have any systemic symptoms like fever, you should always get in touch with the specialist, to visit a hospital to try to find out what exactly is wrong, so that they can be managed and cured early.
Thank you, sir. Then, what are the preventive steps both young adults and senior citizen can consider to have a flexible joint, bone and joint health?
The first of all, what I said, you need to have regular activities, say in the morning, jogging, walking, or young individuals can go to the gym. I mean, going to the gym doesn't always mean that you need to lift heavy weight, build your muscles. Regular activities, regular toning should be good enough. You can be a part of sports, any light activities regularly. And for individuals who are working for long duration or sedentary lifestyle, take a break in between, stretch up a little bit, take a few steps, get up from your chair, take a few steps, do a little bit of free hand exercise. That should do a whole lot of good. In the elderly people, okay, fine, you do not need to do vigorous activities. Gentle walking in the morning, in the evening, or say yoga, that will do a lot of help. And with this, you need to have a good sleep habit as far as possible, have a balanced diet, and have your, try to keep the stress to minimum, as minimum as possible.
Thank you. Generally, we see, sir, whenever we have this bone and joint pain, whether
Yeah.
it's in young adults or for elderly, we try to take some painkiller immediately or spray those relief sprays on us, and for that moment, the pain goes away. But it again comes back. So, when we should understand that what is the right time, we should not do this home remedies and seek immediate help from a doctor.
Look, most of us time and again hurt ourselves by doing any activities. Most of them are innocuous. So if you have hurt yourself, nothing to panic at that point of time. Give some rest, some ice packs, some painkillers like paracetamol, to say in a couple of days or so. Generally, most of the pain and minor injuries get better. So if it doesn't get better, or unfortunately you meet with an accident where your legs are quite deformed, it's swollen, you are unable to move the limb or walk, you should visit a medical specialty immediately. Or chronic joint problems, say you are having pain for long duration, the it's progressively getting worse, joints are stiff in the morning, you are unable to do daily activities, and your things are you'll have a feeling that your things are not normal with you. So at that point of time, you should not waste time trying sitting back and trying to see whether it's getting better or not. Visit any medical specialty, visit someone, take help, so that your problem is diagnosed early, so it is cured early, and you get back to the normal life as early as possible.
This is something, it's very important for us what we have heard for so long. Next is, can this also happen that a small joint bone and joint pain which has been neglected for year long, for months and months, can lead to a surgery?
Sometimes it so happens initially the injury looks innocuous. So most of us think that the thing it will get better with some rest, ice, restriction of activity. But there may be a small tear of the ligaments, there's a small tear of the cartilage which is not getting better with time. You're progressively having difficulty in walking, doing regular activities. So if unfortunately you have any tear of the ligaments, any cartilages which is not healing, which is progressively getting worse, then probably we need to investigate and see if the surgery can cure the problem. The other point is basically in elderly individuals with degenerative disease, what we say the arthritis, the knees are progressively getting worse, difficulty in walking and everything, even shoulders worn out with age. So as long as you can manage with medications, exercise, it's fine. But at some point of time you would feel that no medication or no exercises or physiotherapy is doing good to you. That is the point where we think we need to intervene, maybe do some surgical procedures and help the individuals to get out of pain and get back to their normal life.
Thank you so much, sir, for this insight. Lastly, I would ask if you can tell our audience in a short, in a summarized way, like a few steps or a few pointers how they can, in bullets or in pointers, that how they can manage their bone and joint pill for young adults as well as for regular days, for young adults as well as for senior citizens.
Okay. The first thing is basically what I said, that the chronic diseases, the chronic arthritis or the autoimmune arthritis, they need treatment as early as possible. Visit a specialist, then you need to diagnose them and treat as early as possible. The other is the injuries, the unfortunate events which may happen in daily activities or in sports. If it's innocuous, if it gets better in a few days or so with rest, ice, analgesics, it's fine. If the things gets worse, that means you are having the pain for days together, which is progressively increasing, or you have met with a major accident where you are unable to move the limb or walk, don't waste time. Visit any medical specialty as early as possible. And regarding the prophylactic, yes, you need to follow a decent lifestyle, I would say. Most of us are very busy, and try to find some time for yourself, maybe some amount of jogging, walking in the morning or the evening whenever you're comfortable. A little bit of exercises, it may be free hand exercises, it may be some form of exercises in the gym or regular sports activity. Have a balanced diet, have a try to follow a good sleep pattern. And whenever you're walking for long hours sitting, try to take a few breaks in between, try to stretch up a bit, try to loosen it up. And most important, try to reduce stress as far as possible, because stress also has a bearing on chronic pain. So I would wish everybody to follow a good lifestyle and stay healthy as far as possible. Thank you.